Hey, this is Katy Jeter with the Public Affairs Program here on KNDY. This week, I sat down with Arlene Wessel, the Marshall County Community Health Worker. This is a new project through the K-State Ag Health that started a little over a year ago.
This started July 23rd of 2023.
The K-State Rural Ag Health Project wanted to bring rural health to the 105 counties in Kansas and promote economic growth and prosperity.
There's K-State 105, and by the way, 105 means for the 105 counties in Kansas. K-State has an initiative to promote economic growth and prosperity, in all the counties. They got a grant from HHS, which is Health and Human Services, to start the Rural Ag Community Health Worker Project. And I'm a community health worker, and, the main purposes of this project were to kind of establish resources and a service hub, staffed by a community health worker that works in local extension units, and maybe perhaps working with local healthcare partners. And it's to improve the health and safety of rural Kansans and the agricultural workforce in general.
Arlene became the community health worker because she was a registered nurse before retiring, so she had the education needed, and while in her retirement, she was also volunteering to help Susie Latta with enrolling some people in the community.
Well, I'm a retired registered nurse and a retired nursing home administrator, and in my retirement, I was volunteering here at the extension office, helping Susie Latta enroll people in Medicare and Part D, and it just seemed like an easy transition, that I already had all most of the education needed, and I think mainly because I knew a lot of people in this county and could relate to, farmers, because I am a farmer myself.
She helps many people of any age, whether it's trying to help someone get their younger kids covered or to older farmers that are on Medicare.
Yes, actually it is any age. Like the other day, I helped someone with younger children get her children covered under CHIP. So it is any age, but yes, we do a lot with adults and older folks, older farmers that are on Medicare. We help a lot.
She loves being the community health worker, being a part of a team, and helping someone find the coverage less expensively.
Oh, yes, I really like it. Number one, I like the team that I'm working with here at the Extension office. Susie Latta's taught me so much. And number two, I really like helping people. And, you go home at the day with a good feeling when you've helped somebody find health care or find it less expensively.
Even though this is a fairly new project, the grant for this project is only a 2-year grant, but possibly 3 years if they can get an extension.
Well, yes, it could. This grant is going to be for 2 years, maybe 3 if we are granted an extension, but I could see it possibly being a job for some people in the area, and hospitals or physician offices might see the benefit in it, especially as Medicaid and Medicare allow them to bill for a few more of the services that a community health worker could do.
If you like or need any help with your coverage, you can call Arlene down at the Marshall County Extension office.
Well, they could call here to the Marshall County Extension office at 785-562-3531 and ask for Arlene or ask for the community health worker. Secretary will probably ask you a few details on what you need so that we can prepare some things before we talk to the person.
I want to thank Arlene Wessel for being my guest on this weekend's Public Affairs. If you would like to listen again, you can go to kndyradio.com. Thank you for listening. This has been Katy Jeter with the Public Affairs program here on KNDY.